Erectile function is a reflection of a man's overall health. While many associate difficulties in the bedroom with age or temporary stress, few realize that everyday habits can silently undermine their performance and gradually reduce their ability to achieve or maintain strong erections. These habits, often seen as harmless or insignificant, can have a profound impact on the body's hormonal balance, circulation, and nervous system, all of which are essential for healthy sexual function. Erections do not just happen in isolation. They require an intricate coordination between the brain, blood vessels, hormones, and muscles. If one element is out of sync, the entire process can be compromised. Unfortunately, modern lifestyles are full of behaviors that interfere with this delicate system, and most men are unaware that these daily choices are working against them. The good news is that once these habits are identified, they can be reversed, and sexual performance can be restored, often without the need for medication. Understanding the link between lifestyle and sexual health is not just about avoiding dysfunction. It is about enhancing vitality, confidence, and satisfaction. The following are some of the most common daily habits that weaken often without men realizing it, along with clear strategies to reverse them and reclaim sexual strength. One of the most widespread yet underestimated causes of weakened erections is poor sleep quality. In today's fast-paced world, sleep is often sacrificed in favor of productivity, entertainment, or stress. However, testosterone, the primary male sex hormone, is produced in large quantities during deep sleep. When sleep is disrupted or insufficient, testosterone levels drop, leading to lower libido and weaker erections. Moreover, poor sleep affects the nervous system, increases stress hormones like cortisol, and impairs blood flow. These combined effects directly sabotage sexual performance. To reverse this, prioritize consistent, high-quality sleep, establish a bedtime routine, limit screen exposure before bed, and aim for at least 7 to 8 hours of uninterrupted rest each night. Over time, better sleep will help restore hormonal balance, energy, and sexual responsiveness. Another silent saboteur is chronic stress. While short bursts of stress are normal, long-term stress leads to elevated cortisol levels, which interfere with testosterone production and blood vessel function. Stress also diverts the brain's focus away from pleasure and arousal, making it more difficult to achieve an erection. Men under constant stress often report decreased desire, delayed erections, or even complete dysfunction. Reversing stress-induced issues begins with awareness. Incorporate stress reduction practices into your daily routine, such as deep breathing, mindfulness, meditation, regular exercise, or simply disconnecting from digital distractions. Finding moments of stillness and clarity each day helps lower cortisol levels and reactivates the body's natural sexual rhythm. Sitting for prolonged periods is another modern habit that negatively affects erections. Whether at a desk job, behind the wheel, or on the couch, extended sitting reduces blood circulation to the pelvic region. Over time, this weakens the blood vessels and nerves responsible for sexual function. It also contributes to weight gain and insulin resistance, both of which are linked to erectile dysfunction. The solution is movement. Incorporate regular breaks during the day to stand, stretch, or walk. Engaging in daily physical activity, especially cardio and strength training, improves blood flow, enhances nitric oxide production, and boosts testosterone. Even small changes like taking the stairs, walking after meals, or doing squats at home can lead to noticeable improvements in performance. Dietary choices play a significant role in sexual health. A diet high in processed foods, sugars, and unhealthy fats contributes to inflammation, poor circulation, and hormonal imbalances. Excessive consumption of refined carbohydrates and sugary beverages leads to spikes in blood sugar and insulin levels, which over time damage blood vessels and reduce the body's ability to maintain an erection. High cholesterol and high blood pressure, both influenced by diet, also directly impact erectile function. To reverse these effects, shift toward a whole food-based diet rich in vegetables, fruits, lean proteins, healthy fats, and complex carbohydrates. Foods that support heart health also support your think leafy greens, berries, nuts, olive oil, fatty fish, and legumes. Staying hydrated is equally important. as dehydration can lower blood volume and reduce energy, making it more difficult to maintain an erection. One habit that often flies under the radar is excessive pornography use. While watching adult content in moderation may not be harmful, frequent and prolonged use can desensitize the brain to natural sexual stimuli. It alters dopamine pathways, making it harder to become aroused with a real partner. Over time, this can lead to a condition known as porn-induced erectile dysfunction, where a man finds it difficult to perform without visual stimulation. Reversing this habit involves reducing exposure and allowing the brain to reset. Taking a break from pornography, often called a dopamine detox, helps restore natural arousal patterns. During this period, reconnecting with your partner, focusing on real intimacy, and exploring emotional and physical closeness can reignite genuine desire and performance. Alcohol consumption is another daily habit that can quietly damage sexual health. While a drink or two may help with relaxation and lowering inhibitions, excessive alcohol intake impairs liver function, disrupts hormone production, and depresses the central nervous system. These effects reduce sensitivity, slow arousal, and diminish the quality of erection. In some cases, long-term alcohol abuse leads to permanent erectile dysfunction. Reversing this damage starts with moderation. Limit alcohol to a few drinks per week or eliminate it altogether if possible. Replace it with healthier habits like drinking herbal teas, increasing water intake, and engaging in social activities that do not revolve around alcohol. The body is highly adaptable, and reducing alcohol allows it to heal and regenerate over time. Smoking is a well-known risk factor for erectile dysfunction, but many men underestimate the damage caused by even occasional smoking or vape. Nicotine constricts blood vessels and reduces nitric oxide availability, making it harder for blood to flow to the penis. Smoking also increases the risk of heart disease, which is directly linked to sexual performance. Quitting smoking not only improves erections, but also extends life expectancy and reduces the risk of numerous diseases. To reverse the impact of smoking, seek support if needed, whether through counseling, nicotine replacement therapy, or behavioral strategies. The benefits of quitting begin almost immediately, with blood circulation improving within days. Over time, the body restores function and sexual vitality. Another overlooked habit is neglecting mental health. Anxiety, depression, low self-esteem, and negative body image can all contribute to erectile issues. These psychological factors affect desire, confidence, and arousal. Often, men are reluctant to talk about these issues or seek help, believing that the problem is purely physical. In truth, the mind plays a crucial role in every stage of sexual response. Reversing psychological barriers requires courage and openness. Speaking to a therapist or counselor can be transformative. Practicing self-compassion, journaling, or engaging in activities that bring joy and fulfillment can also elevate mood and restore confidence. When mental well-being improves, erections often follow. Hormonal disruptors are present in many everyday products, from plastic containers and receipts to grooming products and cleaning agents. These substances, known as endocrine disruptors, interfere with the body's natural hormone production, particularly testosterone. Over time, exposure to these chemicals can reduce libido, increase body fat, and impair erection quality. To reduce exposure, choose natural, personal care products, avoid heating food in plastic containers, filter drinking water, and minimize contact with receipts and synthetic fragrances. Supporting the liver through a clean diet and hydration also helps the body detoxify these substances more efficiently. Lastly, skipping regular medical checkups can delay the diagnosis of underlying conditions that contribute to erectile dysfunction. Diabetes, hypertension, high cholesterol, and hormonal imbalances often develop silently, but have a direct impact on sexual health. Many men wait until the problem becomes severe before seeking medical advice. The solution is preventive care. Annual checkups, blood tests, and open conversations with healthcare providers can detect issues early and allow for effective intervention. Treating these conditions not only improves overall health, but often resolves erectile difficulties without the need for specialized treatments. In conclusion, the strength of your erection is a reflection of how you live each day. From the food you eat, to the way you manage stress, move your body, sleep, and care for your mind, Every choice matters. While it is easy to overlook small habits, they accumulate over time and shape your physical and sexual health. The encouraging news is that the body is incredibly resilient. By identifying and reversing these hidden habits, you can restore performance, regain confidence, and experience a renewed sense of vitality. Erections are not just about sex. They are a signal from your body telling you how well your systems are working together. By listening to that signal and making conscious changes, you invest in your overall well-being and future quality of life. Start today, one habit at a time, and let your daily actions support the strongest, healthiest version of yourself.